Hi, my name is Kristen and I'm a myofunctional therapy coach. And today I'm going to talk a little bit about sleep. Now, I've talked about sleep before, but I'm going to talk specifically about the muscles that help with sleep. I actually just recently talked with a few different sleep doctors about this, as well as sleep dentists. Do you know that there are sleep dentists out there? It's amazing. So I'd like to talk about a couple of things that happen when we are sleeping, specifically about our breathing. When we are sleeping, air should be coming through the nose. We ought to be breathing through the nose. And the reason for that is because the air will come in through these turbinates and or concha, kind of like a conch shell, if that makes sense. It has like these little layers that the air can move through or the animal can move through. Anyway, the air will come through, it'll be spun around. And that's really important because as it's spinning, it's touching the mucus and the little hairs that are inside the nose. And that's going to catch a lot of the pollution and different stuff that's in the air that we don't want in our lungs. So it's really important to breathe through the nose so that the nose can filter all of that. Nothing else in the body is going to filter that air. The mouth doesn't filter the air, lungs doesn't filter the air. They're not built to do that. So it needs to happen through the nose. And the start of nitric oxide happens when we're breathing through our noses. So that's fantastic as well. So anyway, the air comes through here, and then it's going to come down the airway, which is past the tongue. So the tongue needs to be sitting in the mouth and not squishing against the airway, being lazy. It needs to be sitting supporting the upper jaw. And then the air can come past, and it can come past down the throat. Now, if it can't do that, if this thing, this punching bag, that uvula way back there, or the tongue is sitting further back, or the jaw, this whole jaw section is sitting in the throat, then that is literally blocking the airway. And if it's sitting just a little bit in the throat, then a person might experience what's called upper airway resistance syndrome, or UARS. Now, if it's more than that, they might experience some snoring. This thing might be waving in the wind. Air makes noise when it hits something. And so if the air is hitting the tongue or the uvula or some other structure like the tonsils or the adenoids, then that is going to create that snoring sound, right? There's a couple of other things that can create snoring, like in large turbinates or like a deviated septum or something like that. But when it happens in the mouth area, that's my area. That's a myofunctional therapist area. And so what we would do is actually literally strengthen the muscles here in the soft palate and get them to sit closer to the back of the tongue so that they are right up against each other, sealed up against each other. The roof of the mouth, if this hand is the roof of the mouth and this hand is the tongue, when the mouth is not being used to speak or to eat, the tongue should be right up against the roof of the mouth from front to back, not just the tip of the tongue here, but the entire thing should be suctioned up there just gently, not with a ton of pressure, but just gently. And that allows this tube, this air tube, to be one full tube and not to have like little openings where the mouth is, because it should not be open if we are not opening our mouth on purpose. So in myofunctional therapy, we work on strengthening all the muscles of the mouth and the jaw. As we work on these muscles and even these muscles, getting these to relax and getting the lips to stay closed, that is going to allow that airway to stay nice and wide open. And actually, the muscles of the tongue and the jaw and the rest of the face interconnect with muscles in the throat. Just like muscles in the heart interconnect, there's no bones in the heart, which is really kind of cool. They are all contracting against each other, but in a way that is very functional and allows our heart to beat, right? That allows our heart to get that lub dub, lub dub. So in the mouth, when the tongue is swallowing or when the tongue is protruding or moving side to side, or even just up against the roof of the mouth, that is working all of those muscle groups in a functional way to help support everything that is going on in the mouth. And if the tongue is supporting the jaws, then the airway is going to stay more open. Now, if a person has a really, really small mouth and they don't have enough room for all of these muscles, then they would need to go get some kind of expansion, whether or not that's like through braces, or if it's really, really bad through maybe surgery, or through some other kind of expansion. Some epigenetic expansion, which I have another video about that if you want to learn about that. Then a person might need to make more space for their muscles by making more space with their jaw bones, right? Because your muscles only have the amount of space that your bones have to give them. And so in the mouth, all these muscles are on the inside, and so they need adequate space. Unlike on the outside, if you want a bigger bicep, it has the room to do that. The tongue doesn't necessarily have a ton of space in the mouth. It only has what it has. And so if you need more space, then talking to an airway orthodontist or an airway dentist is going to go a long way. I've had a number of people who have had jaw strain that they got rid of with just a few easy exercises. And so on my app, there's actually a few exercises that are available to anyone who downloads the app. The rest of the exercises are not available until you're working with me, because I do need to be able to see what you're doing. Quite a few people think that they are doing what I am doing as I am demonstrating it. And in fact, they are using all sorts of different muscles to compensate, and they're not realizing it. And so they're not getting the results that they want. And so I do give a few basic, simple stretches that don't really need to be monitored by me in order to help get you some relief. Hope this helps.